My name is Jonathan Joseph. I'm a consultant ENT surgeon with a specialist interest in rhinology and facial plastic surgery. I also have a strong practice in pediatric ENT. My NHS practice is at University College London Hospitals, at the Royal National Ear, Nose and Throat Hospital, and I do private practice in various hospitals across London. Sleep apnea is a condition which can affect both adults and children, and it causes a restriction in breathing at nighttime. People present often feeling very tired because they have very poor quality sleep, and this has a knock-on effect during the daytime and can significantly reduce a person's ability to function. Children with sleep apnea will always snore at night, and parents will see that on occasion, the child will seem to stop breathing, everything will go quiet, and then after a few seconds, the child will gasp, take a big breath in, and then they will carry on snoring. Children are often also very restless at night because the sleep apnea makes them feel uncomfortable. And these episodes where they stop breathing can happen multiple times at night. And this is, of course, very concerning for the parents who watch them. And then in the daytime, the knock-on effects will cause them to have irritability, sometimes behavior problems, and they also might be quite sleepy, particularly in the afternoon. So sleep apnea affects children when they're awake because of the very poor quality sleep. And the severity depends on how bad the sleep apnea is, and we have various ways of grading this. So I always ask patients or parents if the teachers in the class have reported any behavior or attention problems, whether they seem overly tired and irritable, if they can't join in with games and sport with other children to the level that would seem appropriate for someone of their age. And on a more long-term basis, it can then affect their ability to learn and to access language and to function to their full potential, because their brain will not be able to retain information and make the most from their schooling because of the poor sleep. We diagnose sleep apnea largely through the history given by the parents. They will report the snoring and the pauses in breathing and the frequency with which this happens, and also the knock-on effects during the daytime. If there is an element of uncertainty, or if I feel that the child is suffering quite severely, then I may well arrange what's called a sleep study, where we monitor various parameters overnight, which can be done either at home or in a sleep lab. And this will accurately determine the severity of the sleep apnea using predetermined scales. So the test for sleep apnea is a sleep study. This monitors on a basic level their oxygen saturation through a probe on the finger and their heart rate. On a more complex level, it monitors chest movements, their overall body movements. It can look at brain waves and airflow through their nose and their mouth. And the particular parameters that we focus on, the most important ones, are what's called the apnea-hypopnea index, which is the number of times they either stop breathing or have very reduced breathing per hour. It should happen either 0 times or once per hour in a normal child, and then it can be up to 20 times or even more in a very severely affected child. So the way I manage sleep apnea depends on how long the problem has been present for and how much it's affecting the child in the daytime, and also the age of the child. So we know that in most children, obstructive sleep apnea, which must be differentiated from central sleep apnea, is caused by large tonsils and adenoids. So what I always say to parents is that the natural history and the way it develops with regards to tonsils and adenoids is that as the child grows, there will be more space for them to breathe, the tonsils and adenoids will shrink, and after a period of time, the problem will almost always go away. So treatment only has to be given if the problem is too severe and we can't wait for it to resolve on its own. And the most common treatment would be surgery to remove the adenoids and tonsils, known as an apnea-tonsillectomy, and this can be very effective and normally sorts the problem out straight away.